Okay, we'll get started here. I'm Dr. Jerry Bailey. As you can see, me standing here and me on the screen gives me the authority in the world because I'm on the screen here too. No. I'm getting over a little cold, so I apologize if I cough a little bit here and there. So this is kind of hormone hacking for men or men's health. We're going to focus on the hormones for men because really that's what happens as we age as men, is our hormone levels change. Just like in women, we go through a system similar to menopause, but it's called andropause, with our testosterone levels start to decrease there. And through this, are we going to be able to get you to a level that is, that 18-year-old or better? No. I mean, the only way to get to those levels of hormones is through testosterone replacement therapy. I don't do that. That can be done. But through this, we're just going to get you to a level that actually is supportive to your system, get you healthy, give you the energy that you're looking for to have there. So if you want to, you can take out your phone and you can text HACK to 27126. And then after that will come up, it'll ask for your email, then send your email there, and we can actually send you these notes if you want to. So if it's something you want to do, you can do it now, or you can write it down. We can do it afterwards. In about an hour or two, you'll get the email itself with all the notes from the class here itself. So again, if you want to write that down, it's text HACK to 27126, and then as soon as that sends, send your email, type in your email and send that also, and that will come directly to you. Kind of the new things that's going around, a lot of presentations throughout the country do this because it saves on paper for us printing for you, but it also gets it right to your computer or to your phone so you can look at it as you go along and have it with you at all times there. So, again, this is me, Dr. Jerry Bailey. I'm a functional medicine practitioner, and what I do is I do chiropractic, I do acupuncture, and I do nutrition. So I cover a lot of grounds with patients and getting them better. I'm also a professor at the University of Western States out of Portland, Oregon. I teach in the Masters of Science in Human Nutrition and Functional Medicine there. I actually teach the hormones and neurotransmitters. So I teach students and people the physicians out in the world who are looking to get a master's level program degree on how to work with people's hormones, how to correct them naturally, how to test for them, way better than your average physician knows how to do. I'm also a dad, a triathlete, I do CrossFit, I'm a musician also, and then my story. My story is I started out with my undergrad degree in exercise physiology and nutrition. And from there, I was in cardiac rehab is what I was specializing in, and I wanted to become a cardiothoracic surgeon. So I wanted to do open heart surgery. Spent a lot of time with surgeons at the hospital I was doing my internship at that time, way back in the early 90s. And they said, hey guys, this is what I want to do. And they're like, do something else with your time. I was like, what? They're like, do something else. You make a lot of money, but you're unhappy and you're unhealthy. And you're never at home. And I was like, well, thanks for killing the dream. I said, so what should I do at that point? And they said, go to do prevention. And so I was like, all right, what was prevention at that time? Was chiropractic and naturopathic medicine. Went to chiropractic school, got my degree there. A few years later, I added the acupuncture, and then a few years later, I added the master's in human nutrition and functional medicine. I was the first graduate of that first program, just because my name was Bailey, so I was the first graduate of 13 people. So that's my claim to fame. I always joke with my fellow classmates. I'm like, hey, we all graduated together. I was the first one. But from there, then I started practice in 2000 here in Coeur d'Alene. Been here since, and been busy here and doing lectures throughout the country and online with how to practice functional medicine, which is really just taking you and figuring out what's wrong and how to correct it, versus just going, what's your symptom? Here's a drug to mask that symptom. It's what's going on with you? How can we figure it out through a history? Through taking that history, sitting down, we spend an hour with you in the first visit usually to figure out what's going on, and then correcting it from there, and figuring out what labs we need to do, what supplements you may need, and then developing a plan to help get you well. Athletes spend anywhere from a few months to a few years training for one specific event that they're going to do, and so you can't expect us to fix you in one treatment. And so we always tell people it's going to be a time to rebuild your system, and how far you've gotten down that poor road is going to take us a while to get you back down that yellow brick road through there. So again, this is about hormone hacking, and so evolutionary or not, doesn't matter. I always love this picture because it's like, hey, we get to a point where we're really athletic and healthy, and then we start eating food. We start eating processed foods, and we go down the chain there. So there is no miracle cure out there for anything wrong with you. Most of the time, you can fix what's going on through diet alone, but it's knowing what to eat and how to eat, and also what supplements to supplement your diet that you need to help with getting you better well over time. Whether it's rebuilding the hormone system through guys here or with women too. We work with a lot of women in the clinic also. It's just figuring out what's going on and how to correct it from there. But there is no miracle cure. You know, if you do get testosterone replacement therapy, that's a risk factor in of itself for cardiovascular issues, potential cancer issues there too. So we have to mitigate those and figure out how you're metabolizing those. And there's tests for that, and we'll go over that tonight here too. So this wonderful picture here, as you can see, this nice big picture here, this is really your hormone cascade for the most part. Everything starts at cholesterol. That's why cholesterol is really important, and if you take a cholesterol-lowering medication, your hormones are going to get messed up in both men and women. And so from there, it breaks down into your testosterone, then it goes down into your estrogens, can go over to progesterone there, which are your main hormones, and then the stress hormones, the cortisol responses there. But this, as we work with you as a patient or educate you as we go along, this is what we think about when we're talking to you, is this process up here, what's going on with you, and then how to correct it where those abnormalities can occur within that spot. So you can ask yourself, this is from the Adam questionnaire from Mortal et al., and this really helps to define if you're having an andropause situation as a guy. It's anywhere from 35 years or older. These specific questions will really key in that, hey, we need to do some testing and figure out what's going on and how to correct it. So, do you have a decreased libido or sex drive? Do you have a lack of energy? Do you have a decrease in strength and endurance? So can you not do as much work as you used to, and you're not as strong as you used to? Have you lost height? And that's a big one. Guys, so we start to shrink too, just like ladies do. Have you noticed a decrease in enjoyment in life? Do you feel grumpy or sad? And, you know, there's a lot of days people feel grumpy a lot of the day, or they may feel sad. But are we consistently seeing that pattern through there? For men itself, do your erections, are they less strong? That's a big one. As we age, those erections get a little less stronger there. And have you noticed your decrease in ability to play sports? So as you used to do sports or do some events or different things that you did, you notice, you know, I just don't have the stamina anymore to do that stuff. And I just can't, my physical ability to do jumps or different things, I just can't do anymore. And do you fall asleep after dinner? Or after you're eating, do you notice that you get a meal and then all of a sudden it's like sleepy time through there? And then finally, has there been any recent deterioration in your performance at work? That's a big one. Over 50% of the people in this survey demonstrated that performance at work or satisfaction at work had significantly declined when those testosterone levels started to decrease. So there's that social aspect, that work aspect that can cause that and decrease that, and it shows within this questionnaire there itself. So what is andropause? Again, this is from that questionnaire there. So you know, 51% had trouble at work. Low libido, about 91% of men with lower testosterone levels notice that they have a lower libido. They have 66%, 2/3 notice they had that belly fat gain right through there. They noticed the increasing weight around the midsection. 90% less energy. Depression was, again, about 2/3 of them showed depression there. Concentration issues, you know, 3/4 of them had concentration issues. 3/4 of them had concentration issues. 3/4 of them had concentration issues. Erectile dysfunction, about 80% of those ones there too. And then tired after a meal. That's very common to see, is that you eat and then all of a sudden, they call it the postprandial nap time, all of a sudden you start falling asleep because your body can't handle that meal anymore. So low levels of testosterone there. I always throw these pictures in because you think, you know, this guy's a sumo wrestler, you think he's in, you know, these guys eat like 14,000 calories a day. They're phenomenal athletes for what they do, but don't ask them to go walk farther than a 1/4 mile because they won't be able to do it. So you may have, and this is how they defined it, and how we define it within practice, within looking at you itself, is you have 3 sets of 3 here. You have 3 symptoms of intimacy, some erectile dysfunction, decreased thoughts of intimacy, and then morning erections tend to decrease also. That's one of the things you can tell. They do a test. Simply is just a piece of paper that folds on itself and seals itself, and then you put it around your penis at night, and if you wake up in the morning and it's broke, then you don't have an issue with the physiology of erections, so erectile dysfunction drugs won't work. 3 symptoms of a physical issue, which is that inability to engage in heavy lifting or sports or walk more than a kilometer or kneel, bend, or stoop. But that's a common thing too, that as we get older as guys, it gets harder. That it takes us a while to get down there or bend down, and we can't get back up again. So those are signs of issues itself too. And then finally, the 3 symptoms of psychological issues itself, so loss of energy, that sadness, that fatigue. So as long as you have one of each of these, you most likely have low testosterone. And I can pretty much guarantee you, if you're over 35, you probably have at least one of these, if not 2 of these going on. So low levels of testosterone. So if you're looking at a blood test itself, because a lot of people always ask me, what are the lab values I'm looking for? These are specific for blood tests. We don't do a lot of blood testing itself for hormones in our clinic because they're not very accurate. They give you a small picture of a bound hormone that doesn't tell you much. But people want to know the bound ones because they typically will go see their primary care, and the primary cares might order these tests. So these are those levels we'll look for on a blood work to help determine some things. But we do some different testing that we'll go over here a little bit later too, that really is more effective in determining what's going on with you, not only your base hormone level of testosterone or estrogen or progesterone or DHEA, a precursor to those, but it actually tells us what the breakdown of those, how are you metabolizing those. And that becomes really key if we're starting to give you hormone therapy, that we need to know how you're breaking those hormones down so we can see if you're creating a toxic environment that are cancer-causing agents of those breakdowns. And so instead of just giving you willy-nilly, Pez dispensers of hormones, we want to know what you're doing with those, how your body's handling that, so that way we can give you a better dose that's more specific to you and not just giving you a big dose of something. That goes both along with men and women. Women in particular with estrogens. If a doc's giving you estrogen, they better be testing your breakdown of it. Otherwise, you can be in trouble for potentially having higher risk of cancers. And so we want to know what's going on so we can figure out how to prevent that breakdown or put it on a different chain so it gets to a less cancer-causing hormone that your body can deal with and excrete out of the system. So roughly on a blood test, 2 different values here. It's just they broke it down. So between 8 and 13 nanomolar per liter for total testosterone, which is a matter of how much testosterone you have in your blood, or between 160 to 280 for that free level of testosterone. That's a key one. We want to know the free testosterone because that's what your body's using. Okay, most of total testosterone looks at your free and bound. We want to know how much is free out there that your body can actually use. If it's bound to what's called sex-binding hormone globulin, SBHG, it ain't useful. Nothing you can do with it. Pac-Man got it and it's taken out of the system. There's nothing you can do with it. We want to know what that free is through there.
Is this specifically directed at males or also females?
For the levels?
Yeah, that's what you're talking about.
No, the levels themselves, no, this is male levels.
Male, okay.
Females are different, yep.
Yeah.
These are, if your levels are between there for men, 13 is the cutoff, but if you're in here, you're in low level. If you're below 8, we're in trouble. If you're between 8 and 13, we're in a you're low testosterone, we need to address some things. If you're above 13, they consider it, you're okay. We also look at DHEA sulfate, we look at cortisol, growth hormone, insulin growth factor, your HbA1c here, which is your 90-day regulation of glucose in the blood. That's a huge one because docs can be running tests of just looking at your morning glucose levels, your fasting one, and you're fine. You're like at 98 or 97. They're like, oh, you're fine. Well, if we look at that HbA1c, which is how your body regulates glucose over a 90-day period, that's going to give us a better idea of, are you truly okay, or did we just catch you on a good day? Because what we see a lot of times, the person comes in and they were good for a couple days before they did the test, because they were like, I want to make my test look good. So they eat really good, and their morning glucose is like 90. And they're like, see, I'm really good. And they were like, that's really good. Now let's look at that HbA1c, and their average daily over 90 days is like 120. It's like, no, we're in a diabetic state. We need to work on diet here. So we always can catch people in fibs. It's like going to your dentist. You get a dentist appointment, and so a week before the dentist appointment, or actually a day before you decide to floss your teeth, and the dentist asks you, hey, you been flossing your teeth? Oh, I do it every day. And they're looking at you going, gums are swollen all red. No, you just flossed today before you came in. So we can catch you little fibs there. We look at morning insulin levels, and again, that sex hormone binding globulin. If that is really high in your blood, then we have issues because that's grabbing all the hormones and pulling them out of the system, and so you can't use them. So you may test, if they test just regular, total testosterone or total hormones, you might be normal, but there's a ton of sex hormone binding globulin, which is making it so you have no hormone in the system whatsoever. So that's why we run all these additional tests versus just simple levels, because we want to know what your body's doing there. And then, oh, I hit the wrong button. Good. And then again, if you're below 12 or 225 there, you may need testosterone hormone replacement therapy. But again, we need to know what you're doing with all these hormones and how your body's responding before we say, this is in fact, you do need some testosterone. Most of the time, a lot of times, you don't have to be on testosterone. We can do some supplementation and changes in diet that bring those hormones levels up to where they need to be at without going to a super physiological level. And so a lot of people think like, oh, I want to get really high testosterone so I can build lean mass. You're not going to do that with diet and exercise and good nutrition and supplementation. You have to have exogenous testosterone in for that to work. So that's where a lot of it, you'll see people out in the community or out on talks or different things online, they'd be like, oh, we can raise your testosterone levels to super high levels with herbs and other things. Won't happen. We can get it to a physiological level that's beneficial for you, but to really get to those super high levels, you have to do testosterone replacement therapy, and usually they're taking really high doses to get there. We don't do that. And then if you're above those levels, like I said, there's safe ways, or if you're at that level, we can get you up to safe levels with some things here. So we're going to kind of go over this Adam plan here. This is a book I have coming out next year. I'm finishing up working on here this fall and next spring. It's called the Adam plan, the Adrenal. So androgens being testosterone, adrenal being cortisol or stress response in the body, deficiency in aging athletic men. This is a huge topic. It's growing. A lot of the stuff out there is on women, but hey, I'm a guy. And guys need some support too. And so this is a big one I'm coming out with next year. You'll see it more in the media, hopefully, and out there. I'm so used to hitting this, I forgot I have a clicker, so I'm like going back and forth there. So what do you need to test for? So these are the keys here. You went through there, what I went through was basically your lab levels from blood work, what androgen deficiency looks like, how do we get things to a level potentially from there. What we want to do now is what do we test for? So when we look at you as a patient, we want to test for your DHEA sulfate. We want to test for cortisol itself, which is a stress response hormone, and the metabolites of that cortisol. And I'll share my personal story once we get done here with this slide of what I tested on myself and what I saw in myself from this. And what kind of spurred me to talk about this more and get it out there. So growth hormone itself is a good one to look at. The insulin growth factor, HB1AC, and insulin itself. Those are great ones to look at. Your sex hormone binding globulin, and then your free testosterone, your free testosterone and total testosterone, those metabolites itself. And then again, you want to look at the estrogens, your E1, your E2, your E3, those metabolites itself too. And progesterone, I forgot to put progesterone on here, but progesterone is another one you want to measure too, because that's like total of all the different hormones within the system for the sex hormones, and then the stress hormones, the cortisol, and those metabolites. Those are really key. With that picture there, which this test here, running pretty much all of this, somebody throw a number out there, how much do you think it's going to cost?
$280.
Maybe in Canada.
1,000.
Yeah. No, normally these tests right here would probably run you about $1,500 to $2,000. But there's ways around that. We've got some great functional medicine testing in our clinic. For about $300, you get all these done in a simple test. It's kind of cool.
See, 280.
Close. Close. I know, but that's too,
Sorry,
yeah.
Popped your bubble.
I know. You killed it. You killed it for me there. So some metabolic testing also we might do. The one we like to do is the Dutch test. It's the dry urine to test complete hormones, hence Dutch. You can go to DutchTest.com and look at that test. That tests all the hormones, estrogen, progesterone, DHEA, testosterone, cortisol, and their metabolites, which is key to really see what's going on. We do a GI map, which is a GI microbial, looking at changes within the microbiome within the GI tract, if there's something there. There are excuse me. There are specific bacteria. I just came across this article as I've been working on the book, and there's specific bacteria in the colon itself that actually give off signals to the testes to tell them to stop producing testosterone. Interesting enough, it was, I gotta remember exactly how, gastrointestinal endotoxemia lowered, anyways, it was gelding. So if you ever worked with horses, the gelding is a castrated horse. So they came up with the title of the thing called like, the gelding of the male population from bacteria. I thought it was kind of interesting, you know. Yeah, scientists do that sometimes. We get bored and make up these cool acronyms, and it's like gelding, you know, the horse there. But it was interesting. It was like, we're now seeing this, and the research coming out on GI stuff, gut bugs and microbes, not only microbes itself, but mycobacterium, so the fungals and yeasts, and then also viruses and parasites within the GI tract. The research is coming out more and more that there's a lot of infections within our GI tract that are subclinical that are causing these catastrophic changes in the body, autoimmune disease and everything else. And this is one in particular that looked at causing basically andropause or hypogonadism, decrease of shrinking of the testicles in men from a bacteria in the GI tract alone. I thought it was kind of cool. Organic acids test, which looks at the biochemistry of how your body works. That's a great test that we run also. And then just your basic blood chemistry and cholesterol, and then any kind of functional thyroid testing that we may do also. So these tests right here, if we ran all these tests right here, this is only about $800. That would cover you in a huge amount of information that we can really see what's going wrong with you and how to correct it. That's what I like about the functional medicine testing versus the regular lab testing that your primary can order or will order or a specialist will order. That looks at you in a disease state. Most people are not in a disease state. They're in a dysfunctional state. And so you don't catch that in regular lab work, blood work. You'll catch it through these and you'll see how the body's functioning and how to correct it. So my story itself, I've done Ironman, I've done half Ironman, I do CrossFit, I do a lot of working out. I've done the salivary testing in the past, and that just looks at the base hormones themselves, the testosterone, DHEA, progesterone, estrogen, and cortisol. It doesn't do the metabolites. So I've done my saliva testing in the past. It showed that I was fairly normal. My cortisol curve, which should kind of peak you and wake you up in the morning and then decrease throughout the day. It's called a diurnal curve. So it wakes you up, and then throughout the day it starts to decrease when you go to bed, and as you're sleeping it starts to peak back up again to wake you up. My cortisol curve was near perfect. It doesn't show metabolites. My other hormones are pretty darn good too. The Dutch test came out and we started utilizing it, and as anything in our clinic, we do testing on ourselves first before we offer it to any patients so we know what it shows. Mine showed my testosterone was really good, my DHEA was really good, my progesterone was really good. I produced way too much estrogen. And my metabolites were off the chart too, so I wasn't detoxifying from those estrogens. My cortisol curve was normal, but my metabolites were off the chart. It's supposed to be like around 5,000 or 6,000 or less of your cortisone, which is the breakdown of cortisol. And I'll show you the next picture. I'll show you what that looks like. I was at 15,000. So I'm burning through cortisol like crazy because of the amount of work that I do with working out and everything. So it was interesting what it said. What it showed me was, hey, no matter what I do, even when I train for Ironman, I'm considered a Clydesdale. I'm about 225 pounds most of the time. So I race kind of the bigger guys. No matter what I did, even for Ironman training, I really didn't lose any weight. I lost like 10 pounds, but my body fat stayed the same. And I went from about 7 hours a week of training to up to 20 hours a week of training during Ironman training. And I didn't lose body fat. I just shrunk a little bit. And so that showed because of my elevated estrogen levels, I was protecting the fat in my body. And we've done a bunch of guys in the last 4 months on this, and nearly every single one had elevated estrogen levels. And so we had to do some blocking of the estrogen. As soon as I did my test and been on an estrogen blocker, my body fat decreased 5% in 2 months. Like that.
What's an estrogen blocker?
It was an herbal product that actually blocks the body from converting testosterone to estrogen. So again here, so as we look, cholesterol comes in, just follow the red dot there, comes the DHEA, then comes down and produces the testosterones. From those testosterones, then it creates the estrogens. So I had good levels of the testosterones, the DHEA, the progesterone over here, but I had elevated levels of estrogen. My body was converting this too much to estrogen, and then the breakdown of those was elevated also. And so that was catching that. So my risk factors for cancers, estrogen-related cancers in men, was elevated because I'm producing too much estrogen, and I had some genetics within there that I was not able to get them out of my system. So I couldn't break them down, or I broke them down too well, but I couldn't get them out of the system. So I was increasing my risk for cancers because of it. So I had some other things to help with detoxification in there too. So I'm about 2 months out from retesting again, because I'm going to test at 6 months to see how my body's doing now with what I've been doing from there. And then the cortisol itself here, this right here, the stress hormone here, cortisol, breaks down into cortisone and then some other cortisol breakdown and cortisol metabolites. And what that does is that was telling me I'm just burning through it like crazy. So cortisol is a stress response. You have your immediate stress response, was that fight or flight, that epinephrine, like, oh my gosh, I'm stressed, I got to get out of here, oh my gosh, the tiger's going to get me. Then shortly after that, cortisol comes into play, which then keeps that system amped a little bit, but then eventually coaxes it down. But in chronic stress, in today's chronic society of chronic stress and changes in environment and pollutions and everything else, is cortisol stays elevated, and that degrades the system a lot quicker through there. There's a new term. There was an article that just came out, and adrenal fatigue or adrenal insufficiency has been a term within functional medicine and natural medicine for a while. We've called it that because we had no other definition to call it, which is basically your body can't handle stress really well because it's being burned out through here. But the medical doctors just came out with an article earlier this year or a few months ago that said there's nothing in the literature that supports the diagnosis of adrenal fatigue or adrenal insufficiency. So it's this big thing, and they're, it doesn't exist. We're like, well, the term doesn't exist because it hasn't been researched in that terminology within the literature. But if you actually go within the world of sports medicine and sports nutrition, there's a ton of research that shows it's basically called overtraining. And it's the same thing, the body's stressed out from overtraining, but it's not training, it's just overstressed. And so there's a new term that we're coming out with right now, it's called CUSMIS. I think of Christmas, but it's CUSMIS. So it's chronic unpredictable stress that causes maladaptive stress syndrome, or CUSMIS. So we have bad holidays, we have CUSMIS versus Christmas. Yes, yeah. So the number one thing we want to do really with this is, once we look through here, is the diet. This is what we kind of follow in our clinic, is the diet plan. There's a way to eat, and then we're going to correct, which is the first one. The first part of diet is your digestion or foods that you're eating. The second part is insulin resistance, which becomes part of this. And then E is for endocrine or your hormone system itself, and then T is the treatment itself. So this is the plan we follow. We call the diet plan within our clinic itself. Kind of a cool little acronym. Most people say diets don't work. This diet works. So, what we eat is the most important. If you haven't had dinner yet, you're going to get really hungry over the next 10 slides. So what we eat is the most important thing there. Here we're taught this for the last 40 years, that this is healthy food. You got your dairy, you got your pastas, you got your breads, your potatoes, some beans there, that this is a healthy diet. What have we seen in the last 40 years? Chronic disease go off the chart. Diabetes, hypertension, cholesterol issues, cancers, dementias, you name it, and it's the food that's doing it to us. So certain proteins here are bad. These ones are bad proteins. Certain proteins are really good. Your fish, your wild-caught fish are really good for the most part. Your lean meats, preferably wild-caught or organic or grass-fed through there. Eggs, these are really good proteins that we should be having every single day. Certain carbohydrates are bad. We got our breads, our rices, some cornmeal right there, the pastas. Breads and pastas are meant to be just a small addition to the diet, occasionally having within there. In the Bible it said, what happens when you get together with a group? You break bread. Yeah, that was for celebration. It wasn't every single meal, every single snack that we have. If you look at all the processed foods in the grocery store, every single thing is some kind of grain, usually wheat or a byproduct of wheat, dairy, and sugar. That's your three food groups for the majority of today's society. When we work with people on diet, we say, hey, we need to change your diet. We're going to take these three things out, and we're going to open it up to pretty much every vegetable known to man, ton of meat, a little bit of fruit. We're just going to avoid those three things. They're like, that's too restrictive for my diet. The most common thing I hear is, that's restricting my diet. I said, I always go, let's think about that for a minute. You have three foods that you eat: grain, dairy, and sugar. Those three things. And I'm telling you, don't eat those three things, eat everything else on the planet pretty much. And they're like, it's too restrictive. I'm like, 3 or several thousand. Doesn't make sense to me. But, so those carbohydrates are bad. Sugar is bad. Sugar's really bad. Those simple carbohydrates from that last slide right there, what do they do? What do they do in the body? They convert right to sugar, right to glucose there. So this is a cool little study that they did that will show you what sugar is doing to us as men, how it changes our physiology. So one 12-ounce soda, has about 75 grams of sugar in there. That's a lot of sugar, okay? Within an hour of drinking that soda, you decrease your testosterone levels 25%. With one 12-ounce soda. Big question becomes, who drinks a 12-ounce soda anymore?
Gotta get a big gulp.
Got to get your big gulp. Got to get your super big gulp. Got to, you got your 44 ounces. You got your 4 sodas right there. They didn't even look at that to say, what's that going to do? That's 4 times that amount of sugar. It's not going to be a 4 times that, so it's not going to be a 100% decrease of testosterone in that hour, but it's probably going to be a 75% decrease just from that sugar alone through there. So, I mean, just the food itself, what it's doing to your body. People don't realize that. So, any excess carbohydrates do the same exact thing. That same exact thing. So if you're getting nothing but grains and breads and cereals and pastas and those things in your diet and crackers, you're doing the same thing. You're decreasing your testosterone levels. And in this study itself, 15% of the men with normal testosterone levels that around that 12, 13, or 14, or a little bit better, the anymore there in the blood supply, 15% of those that had normal testosterone became hypogonadal in that hour, meaning their levels got so low, they were now considered infertile, no testosterone in their body whatsoever. Just from one soda. That's what the food does to us. That's what these foods do to us. So who wants a soda? Yeah. So carbohydrates are good. Look at all those wonderful foods there. Going from that one page of just basically brown food to the rainbow. I always tell patients, this is from one of my great mentors, who I love dearly, Dr. Deanna Minich out of Seattle. Wonderful lady. Her whole thing is all about eating the rainbow. As Skittles has that taste the rainbow, I'm like literally eat the rainbow, like just eat all the colors you want of foods. Certain fats are bad. Certain fats are good. I mean, this doesn't look appealing at all. It's just a yellow, looks like urine in a bottle. These look great. You got avocado, you got some olive oil there, you got salmon there, you got all the different nuts there, you got walnuts up there, which are really good. Some filberts. What are those bottom ones called? Macadamias? I don't know macadamias. Those are pistachios. Those are really good. All really good nuts there for you. So fats are good. And then here itself, again, that steroid, the hormone cascade through there. That is really key. This, like I said, when a patient comes in to see me, this is what I look at. This is in my head the whole time I'm talking to them. And I can just sit there in my head and go, yeah, you got symptoms of this, you got symptoms of this, here's what it is. This chart, what we do, this isn't the best one, but if you take a line and draw it right, kind of like right there, kind of like on an angle through that spot, from cholesterol down to estrogen, just like that. This side here, this your right side, my left, this is rest, digest, and reproduce. Okay? This side over here is fight or flight stress response. So if we're under a lot of stress, we're shifting from that rest, digest, and reproduce over to fight or flight all the time. This is where the infertility comes in, not only in women, but men too. If we're fighting or flighting, we don't need to reproduce. This isn't always the goal for patients. Patients that have had their kids and everything else are in their 40s, and we talk about rest, digest, and reproduce, they're like, whoa, I don't want any more kids. Like, I don't blame you. But it's that balance there. Is the body's going to start pulling from here, so these levels start to decline significantly as the more stress we have. Aldosterone is this hormone here. Aldosterone on this bottom side over here. That one helps regulate blood pressure. So if we have more stress in life, what happens to our blood pressure? It starts to elevate. So, and the key here too, in diet itself, we don't get enough fat in our diet. So that's why we have to increase fat in our diet most of the time to actually help hormone levels. If you give a cholesterol-lowering medication, you lower hormone levels throughout the body. But if you increase fat, you actually help hormone levels significantly. We're a big promoter of the Paleolithic style of eating, or Paleo-Mediterranean, or a whole food-based diet, because that's healthy for us. It's healthy. And that's what we go over with patients. We go over that kind of paleo food pyramid. We're used to the food pyramid. What you don't see on here is grain at all, or dairy on there, because we don't need those foods. They're just fillers, they're just starches. But we say, a lot of good meat in the diet, good amount of vegetables, a small amount of fruit, and then your fat, your nuts, your coconut oils, the olive oils, those things like that. A whole food-based diet. If it comes in one phrase I always tell patients, if it comes in a box, bag, or a can, or made by man, don't touch it. It's got a label on it and a sticker that has a barcode, except we're doing it on some vegetables and fruits now, so I got to kind of back off a little bit from that. But if it's got a label on it, it comes in a box, bag, or can, or made by man, probably shouldn't touch it. Look at the ingredients and see what it says. It's got more than a couple, it ain't good. Wheat, dairy, sugar, get rid of it. It's not a food. It's a factory food. So the paleo diet, like I said, we want the coconut oils, olive oils, good wild meats, nuts, tart fruits are good, and then your vegetables all through there. It's not Cheerios, it's not sugar. Remember that one single can of soda, what it does? Cut your testosterone by 25%. Huge. So your candy bars. And a lot of people think that the agave nectar, you see that at Costco, like, oh, organic agave nectar, that's good for you. It's really no different than high fructose corn syrup. It really isn't. Got to watch the sweet fruits. You can have them, your pineapples, bananas, oranges, and things. Just you don't want to have a lot of them. The grains, breads, genetically modified foods, extracted seed oils, and then dairy itself. There's a few things I say that dairy are okay. If you can get some grass-fed butter, cool. That's fine. Costco has it. It's the Kerrygold. That's really good. Your Whole Food stores here, like Natural Grocers and Pilgrims. We love Natural Grocers. Shop there too. They're great stores that really help support the community, give back to the community, and they have great resources in there for you. Eating this way is really key because, one, it's going to benefit your life overall. You're going to see your blood sugar start to stable. You're going to burn stored fat off because our body burns fat in the flame of carbohydrate. We roughly have anywhere from 1,200 to 1,500, 2,000 calories of carbohydrate stored in our system at any time. The rest is fat. And so if we're constantly getting carbohydrate, the body doesn't know what to do with it, and so it converts it to triglycerides, and then puts it into the arterial walls, creating atherosclerosis, or clogging of the arteries, which leads to stroke, heart attack, those type of things. Fats, it knows what to do with it. It utilizes it to go to cholesterol, or to go to hormones. So it knows how to do it. We have to teach our bodies to be more fat burning than carbohydrate burning. So it does that. It helps reduce allergies significantly because you're not getting the same foods in over and over and over that inflammatory the system. Helps you with working out. It balances your energy throughout the day. If you become a fat-burning energy source, if your body becomes fat-burning, your energy stays level throughout the day versus that peak from that sugar load and then crash because the insulin drops it again. That peak again, that drop, we call it the Snickers coffee or Snickers Mountain Dew diet, where it's like big bolus of sugar, crash. Big bolus of sugar, crash. This style of eating keeps you steady throughout the day and gives you energy all the time. It's anti-inflammatory. It actually clears your skin. Your teeth get better. And what really people notice is their sleep is significantly better. Significantly better eating this way. Sleep apnea decreases significantly because they're not inflamed anymore. You're inflamed, you're snoring like crazy. Change diet to a more, we call it whole food or Paleolithic style, Paleo-Mediterranean. There's different terms for it. Your inflammation is going to significantly decrease in the body. Snoring stops.
Will you just talk a little bit more about how it clears your skin?
Yeah, it's through the inflammatory process. So if the gut is inflamed, there's different bacteria like I talked about earlier for men that can attack the testes and decrease inflammation that way. There's specific bacteria that will mimic skin texture and or mimic some of the skin cells, and then so you get an immune response against that, and then that causes acne. So it decreases inflammation, decreases that immune response that can create those skin conditions like that. I had a young gentleman young 16-year-old boy, wonderful guy, anxious and nervous, and skin and acne, and he had some focusing issues, and they kind of diagnosed him with ADD, ADHD. Super bright, off the chart bright, but just couldn't focus. So we did some testing on him, and I've only saw him, the second time I saw him was Wednesday, and I saw him about a month before because he had to do some testing to get done before he could figure it out. He only been on the products for 2 weeks, and I put him on a couple different products from his testing. His estrogen was high, his testosterone was high. He's a teenager, so I expect with puberty hormones are going to be really elevated. His were off the chart. His cortisol was off the chart. He had some genetic issues too. They're showing some issues with some of the genes that contributed to brain inflammation. So we just focused on inflammation and a couple things to help with hormone levels with him. He had acne. He came back 2 weeks later. When he first came in, he wouldn't even look at me. He barely talked. Just very anxious, didn't like talking to people. First thing I came in the room, he's like, "Hey, Dr. B, how's it going?" I was like, "Who's this kid?" And I'm talking, and he talked the whole half hour I was in there with him. And the first time he didn't. His mom talked most of the time. And I was like, "So how's it going?" He's like, "Pretty good." I'm like, "Well, good. What do you notice?" And he's like, "I get up in the morning. I feel better. Last few tests I've taken, I've got 100% on. I've actually doing my homework now." He wouldn't do his homework at night because he couldn't stand sitting and do his homework. He'd done his homework and stuff. And I'm like, "Well, how's your skin doing?" He's like, "I don't know." And I looked in the mirror, and there it actually was better. He couldn't believe it too. I was like, "Yeah." Within 2 weeks of being on the stuff, his skin started to clear too. So hormones are key with that, but also looking at digestion and inflammation associated with that too is going on there. But this happens when you start eating healthy. You get off those grains, get off those dairy products and those things. And again, what's kind of key too here was the article that came out that intermittent fasting with high intensity interval training, so doing basically just really intense working out for like 20 minutes, along with fasting for a little more, like 18-hour fast versus a 12-hour fast. A lot of people will stop eating at 6 or 7 o'clock. They don't have breakfast till 7 o'clock the next morning. They showed that intermittent fasting, which is every so often not having breakfast till noontime and getting a morning high-intensity workout in, increase your testosterone levels by 400%. Just by simply fasting for 6 more hours than you normally would. That's why it's called breakfast. You break your fast. But adding just that little, and not doing it every day, but doing it once or twice a week along with a really intense workout in that morning time, you increase your testosterone levels by 400%. That's huge. That's huge. That's better than most medications you can take to boost testosterone levels. That's a big one. So we kind of took care of that D of that diet, as I was talking about there, the diet portion of the diet. And then, so now we're going to talk about the insulin resistance. And this occurs a lot with diet itself. As I tell patients, I can give you supplements till the cows come home. I can make you spend a lot of money on supplements. But if you change your diet, there's only a few things I'm going to have to add in. And that's it. I just need to supplement that diet versus giving you all these supplements, which is basically no different than what medicine does, is give you pills and pills and pills. If you change your diet, 50 to 80% of your symptoms go away in a short period of time. Anywhere from a couple weeks, depending on what's going on, to upwards of 6 months. 50 to 80% of what you're experiencing goes away. Just by changing your diet alone. That's huge. That's huge. But insulin resistance is part of that. As we're eating that Western standard American diet, high grain, high dairy, insulin resistance becomes very common. Diabetes becomes very common. Because the body's getting so much glucose or sugar in from those foods, it doesn't know what to do with it. The cells are already packed full, so it starts down-regulating the ability to pull that glucose into the cells. Then the glucose stays elevated. So then they're like, okay, glucose stays elevated. What does the body do? It starts converting it to a triglyceride and then to cholesterol. And then all of a sudden your triglycerides are elevated. Then your cholesterol's elevated. Also, now we got to give you anti-cholesterol medication. And then, so then all of a sudden, that starts going down. Well, your glucose levels start going back up again because you're blocking it from converting to this start. So then, now here comes another diabetic medication. Now, all of a sudden, your glucose starts going up and your cholesterol starts going up, so it becomes this teeter-totter effect of medication after medication after medication instead of addressing the underlying thing, which is your diet. The cells are like, hey, we're full. We can't get any more in. You can force it all you want. We can't do anything with it. And so that will correct insulin resistance that way. So how do you do it? Whole food diet. Just like I talked about, that Paleolithic style of eating, diet's number one. The intermittent fasting, like I talked about in that last slide, just adding, they've shown that just intermittent fasting, you actually increases your body's ability to pull glucose into the cells, which in turn increases testosterone levels. Kind of tricky how that is, huh? So if you increase your dark green leafy vegetables, that also helps with that, because what that does too is helps your body get rid of estrogen in the blood supply for men. Women too. It'll help pull it out, help stops it from being recirculated back up into the system from the colon itself, helps flush it out through there. Again, exercise is really key. Make your muscles thirsty for glucose, for sugar through there, for that glucose. If you exercise, your body's going to want to pull stuff out of the blood supply to drive it down. It's going to start upregulating those insulin receptors, so it starts pulling more glucose into the body there. And again, just adding that high intensity interval training again with a little bit of that intermittent fasting. Whoop, go back. Oh shoot! You increase that testosterone by 400%. That's huge. That's huge. And then this is interesting. I love this one. Get outside. They did the study. They took men. They said, sit here. Let's see what happens to your testosterone levels. Start to go down a little bit. They said, okay, we're going to take you outside. We're going to hoop and holler and yell and be crazy, be like kids again. Get outside, make noise, yell. I always say rock out. Just get outside and rock out. Within 20 minutes, the testosterone level started to increase significantly, just by getting outside and yelling. Not at your kids, not at your neighbors, not at your spouses or your friends. Just getting outside, just whoo, having some fun, increases those testosterone levels. That's one thing we don't do. We don't get outside and be crazy anymore.
Football.
Well, yeah, true. Now, but what happens at football games?
You lose.
Beer,
Oh,
hot dogs, chips,
Pretzels.
pretzels,
Hold
so
it.
sugar, soda. So you're like, yeah, I'm having fun, but now I'm decreasing significantly because of that. So, yeah, football game, yelling and screaming, yeah. But then you add in the diet portion of it, the eating portion of it there, and you just kill it. Yeah. So we've covered that D portion of it, the I, the insulin resistance that happens. And this not only is for men, this is across the board for men and women for most conditions. We correct the diet and digestion. We correct the insulin resistance. Now we're going to go over to the endocrine portion of it, the hormone portion of it itself. You're going to see a big change going on there. So here, this was interesting. The, who is it? The International Endocrine Society does a publication every 5 years, I think it is, where they look through all the literature and determine what's going on. They came out with a big one a few years ago called Endocrine Disrupting Chemicals in Today's Society. $340 billion a year in healthcare costs alone from endocrine disrupting chemicals. Plastics. Glyphosate, Roundup, that's sprayed on your foods. Chemicals in the water, chemicals in the environment, persistent organic pollutants, exhaust from cars, off-gassing from the chemicals in paint, in cleaning houses and everything else. $340 billion per year alone in healthcare costs and expenses from just those chemicals alone. That's huge. Huge. I'll take 1/10 of that. Put it in my pocket, we'll call it good. $340 billion a year just associated with junk in the environment that's causing hormonal imbalances in people and in kids. We're seeing it more and more. Kids today, for a few of you here, myself included, anybody older than myself, we didn't have this stuff in the environment when we were growing up. This stuff wasn't around. The kid today, there was a study done in 2012 or 10. They took the umbilical cord of 200 or 1,000, they took the umbilical cord blood from 1,000 kids, I think it was, I don't remember the exact number, and tested it for endocrine disrupting chemicals or other pollutants in the environment. It averaged 268 different known chemical carcinogens, endocrine disruptors, toxins within the cord blood of newborns. That blood never saw the outside world. and they're born that exposure already today. That's insane, insane. And we're seeing it with kids. We're seeing cancers in younger adults, younger women and men that should not have these cancers. Not that the old people should have those cancers either, but we're seeing all this stuff coming up, and it's because of that endocrine disrupting chemicals. So, as I talked about that earlier, that microbiome within the GI tract itself can cause decreased testosterone and increased estrogen, which leads to that gelding effect. I still crack up about that. I have friends that have horses, and I'm just like, great, now we're compared to horses, guys. But yeah, the gelding effect from there, that those microbial changes, those specific bacteria are partly causing this too. So that's why I was saying that testing, if we can run that Dutch test, run that GI mapping so we see if bacteria is there, we can see if we need to treat that colon itself and that gut microbe and kill things off and then replenish it. We can see what's going on.
How do you do the GI mapping?
It's actually a stool test.
Oh, okay.
Yep, we test your poo. And one of my professors in my master's program, wonderful guy, still teaches at the program. What was that?
SOS.
Yes, yep, pretty much. Here's a little fry container, catch it. That's what it is. One of my professors, and he still teaches in the program he is Canadian, but he lives in Australia. Imagine that accent. You could hear both there. But he taught us the GI stuff, and the way he said poo was just so funny, because it was that Canadian English Australian way of saying poo. It was so funny. We would just laugh. So your health and beauty aids. If you're ever in a grocery store and you hear from on HABA, call, tab please, HABA. That's health and beauty aid. So that part of the grocery store is there. So deodorants, toothpaste, gels, and soaps. Those things themselves, they have phthalates, parabens, bisphenol A, glyphosate, which is Roundup, genetic modification within there too. Those things are endocrine disruptors. So if you go home, grab your soap, grab your shampoo, grab your mouthwash, your toothpaste, your deodorant, your hair gels, and look for those words. Phthalates, parabens, bisphenol A might not be in there, but if it's in a plastic container, it probably has bisphenol A in it. Won't say Roundup or anything else in it, and won't say GMO. Look for those. If it's in it, get rid of it. Find and go to natural grocers. They have the stuff that's safe for you. Those are part of those, which is in everything. Ladies, your makeup. Look what's in your makeup. Those things too. And again, there's that part of that $340 billion a year of chemicals in stuff that cause these problems. Let alone look at aluminum within there too. Aluminum's in there for your deodorants. If you wear it, don't wear antiperspirant because it's got aluminum. Antiperspirant with the aluminum, we absorb that aluminum, that increases aluminum within the brain, which is Alzheimer's and dementia. Gotta get rid of that stuff. This is a great article that I just read the other day. They did it with men. They had this light therapy. And for 30 minutes, with a 10,000 lux light bulb in a little shadow box, with a UV filter so you didn't get any UV exposure there, but 30-minute exposure with this 10,000 lux light bulb increased testosterone 71%. 30 minutes a day, just when you get it, or they just had them get up in the morning, sit in front of this light box while they did stuff, increased their testosterone 71%. I ordered one. Don't tell my wife. Yeah, when I do my exercise in the morning, I'm just going to pop it up there either above my bike or above my treadmill, so it's just hitting me and just giving me that boost through there. And then what happens too, as we increase this testosterone, this is what it was. They actually did a study where they showed the more increased intimacy partners had together, the better the testosterone level was in the men. Less intimacy between husband and wife, or spouse, or boyfriend, girlfriend, whatever it is, testosterone levels decrease. The more intimacy they had, the more testosterone was there. So have more intimacy with each other there. And then, again, do the testing so we can see what we need to balance. Balance the hormones and the metabolites so we know what your body's doing and how to correct it if there's an imbalance there. So we covered the D, we covered the I, we covered the E.
Yeah, what kind of light is that anyways?
It was a 10,000, actually this light itself was a 10,000 lux, so really dang bright, fluorescent bulb. But they did put a UV filter on it over the box just to prevent any kind of UV radiation from that 10,000 lux light. But that's all it was.
Wow.
Yeah. I thought it was pretty cool. I was like, geez, that's cheap therapy. Plus, it'll help with seasonal affect disorder. You know, especially right now, this, you know, dark at 4 o'clock stuff and pretty soon dark at 3 o'clock stuff, and not light again till 2:30 the next afternoon. We get that half hour of light right now. This will be significant in helping there. So we covered the D, we covered the I, we covered the E of the diet. Now we're going to go for treatment. So here are the things that we do that can help with there, are things you can take to help with things. I love that little picture right there, the little guy just being strong. So vitamin D3, zinc, DHEA, Tonka Ali, and omega-3. Tonka Ali is just a herb. That one does show that it helps boost testosterone levels. Again, these are not going to get you to that super physiological testosterone level that an 18-year-old may have, or to that level to really build a ton of mass and, you know, all of a sudden you got all this testosterone. This is going to get you to a physiological level. This is going to help build you up to that level. It's not going to be where you're thinking you're getting testosterone therapy and you're going to really get to those high levels of in the blood supply. This is going to get you up to where you should be at and be balanced through there. Okay. So those vitamins and herbs and minerals right there are really good for you. And one of the things on my testing, like I said, you know, I produced too much estrogen. When I would take DHEA, I wouldn't convert it to testosterone. I would convert it to estrogen. And my wife noticed that as each time over the past couple of years before I did the Dutch test, when I would say, you know, I'm kind of feeling a little punkish, I'm going to do some DHEA for a little bit. Within a week, I was grumpy. And she's like, are you doing DHEA again? She's like, yes. Why? She's like, I can tell. And so it was. So when I take, that's what's nice about testing is we can see from that and then correct it from there to make sure it's working the way it's supposed to and your body using it. I don't need DHEA. I just need to block that estrogen from being made. So that's why the testing comes in handy, is I can tell you as an individual versus you as just a statistic there. So hormones itself, we can do estrogen blockers like I'm taking, testosterone replacement therapy. You can also do some testosterone boosters. But again, any of those herbal testosterone boosters aren't going to put you in a state of super high levels of testosterone. They're just going to get you to normal physiological levels. That's one thing we have to remember, is the only way to get to those super high levels of testosterone is to take testosterone. We don't want to get you there because there's too many side effects associated with that. We just want to get you to a level that you feel good and you're within range of what you should be, hopefully on the upper range of normal versus lower range or mid-range, with that mid to higher range for you there.
What type of boosters?
That Tonkat Ali, that one itself will boost testosterone. DHEA will do it. Tribulus teridus, which is a herb one, that one's been around a long time. That one works really well for that too. So those are kind of the herbal ones that work well with bringing those testosterone levels to a normal physiological level.
What's O3?
Omega-3 fatty acids.
Oh, okay.
Yep. Or super oxygen.
Yeah.
O3 there.
Perfect.
Yeah. So, and again, increase that fat in the diet. The coconut, the avocado, the walnuts there. Those are all good fats that help build testosterone. Remember that slide I showed you, that cholesterol at the top, all the way down to the bottom for the testosterone estrogen? What's the key? Cholesterol. We have to have cholesterol. Making sure you get rest 8 hours a night. That's a huge one. They've done tons of studies that have showed if we get enough rest, at least 8 hours, our testosterone levels start to improve significantly. What do we not get today? 8 hours of sleep. Uninterrupted sleep. Decrease our stress, increase testosterone levels. Correct any issues or metabolic changes that we see within the testing itself. And then exercise. Excuse me. Those are all key things within the treatment to get you better and making you feel better. And then again, that diet, like we talked about, eating the way you should. And then also the diet that works, which is correcting your diet and digestion, insulin resistance, any kind of endocrine disruption that can occur there. I didn't touch on thyroid, but thyroid also has an effect on stuff too. Thyroid's a key one. Most docs just order TSH, thyroid stimulating hormone, when they look at your thyroid. That's really just a tip of the iceberg. We want to look at your free T3, your free T4. Free T3 is your active hormone in the blood supply. Your free T4 is your storage form. We want to look at your antibodies, and then also your total T3 and reverse T3, which is a mirror image of that free T3 that actually blocks T3 from getting in the cell. So we can actually see if you have elevated reverse T3 along with elevated cortisol levels and then some other markers within there. We can say you have that cusmus. You're not responding appropriately to stress anymore. We need to address that stress response, whether take you from that fight or flight to that fight or flight mode to that rest, digest, or reproduce mode. So take you from sympathetic drive to parasympathetic relaxation, and then make your body adapt the way it's supposed to versus being in that chronic state there. So the testing gives us a clue on how your body's actually working there. We're trying to change the dialogue out in the world of saying less of adrenal fatigue and insufficiency because the medical community doesn't recognize that. So we're using better terms that work and they'll understand. Especially because they just had that, like I said, that article that came out and said it doesn't exist. We're like, okay, fine. What do you want us to call it then? They don't want to call it anything because they don't know what to do with it. So that's the key. Those treatments there, those are really key. But really the underlying is figuring out what's going on and then figuring out how to correct it from there. Looking at you as an individual and then correcting it. So again, that was my book that's going to be coming out, the Adam Plan there. As you can see, the androgens, the testosterone there, the adrenal issues we talked about, that cortisol, that cusmus response, deficiency in the aging athletic male. If we can correct this stuff in men, get you eating well and exercising, majority of your health concerns go away. Cholesterol decreases significantly, glucose issues get better, the aging process within the brain, dementias and Alzheimer's significantly changes within there. Stress in the body itself goes to the brain and just degrades it like crazy. And for many of the Parkinson's and Alzheimer's patients that we see come in, it's mostly men that have the issue, but with spouses are bringing them in, the women are bringing them in going, he's going fast. And I said, what does he like to eat? And she's there, every single one, he's addicted to sugar. All he wants is candy all the time. Like, that's what's causing the problem. Get them off the candy and sugar, they respond really quickly to stuff there. So, this is towards the end here. I always put this up here to let you guys know. You can go to our website, on our Facebook page too. We're on Twitter and YouTube and Pinterest and all these social media things out there. You can go sign up. We do a monthly newsletter there. We also have education video series that we're doing also. We put within there, like I said this morning for you that were here earlier, I was on a call it was 8 o'clock our time and 4 o'clock in the UK, so it was that time change. We're trying to figure out how we could do it. I was on a call there for a TV show, radio show there on this type of stuff, educating over there because they're starting to be aware of things even more so. So we're on stuff and you get access to that also. So if you're interested in getting our newsletter, go to our website. You'll get a little pop-up that comes up right away. Just put your email in there. You'll go right to our system and start getting our newsletter each month. We got one coming out the 1st, which is Tuesday. We usually comes out the 1st of the month. Through there, we do recipes within there, so great foods and everything. So go there and do that. And then eat the good foods. Eat the rainbow through there. And then thank you. I'll open up if you guys got questions. We'll go over questions if you got anything. And we'll go from there. Let me just stop.